I'm Dr. Joseph Akinde, consultant obstetrician and gynecologist. I work on voluntary basis for the Sickle Cell Foundation of Nigeria to carry out procedures to determine the genotype of the unborn baby. We call it prenatal diagnosis of sickle cell disease. This procedure will be performed in this place over the last 25 years or thereabout. It was introduced into Nigeria in 1993, and during this period, we've done close to 3,000 procedures, successful procedures. It enables couples at risk to know the genotype of their unborn baby as early as 2.5 months, 10 weeks of pregnancy. They can come for the procedure, and usually within 2 days, their result will be available so that they will be prepared to know the genotype of the baby. Now, optimally, this procedure should be done between 10 weeks and 13 weeks. But because of the peculiar situation in Nigeria, we have couples or we have clients coming as late as 20 weeks, 21 weeks, 22 weeks. We still carry out the procedures for them. But ideally, we want them to come in between 10 weeks to 13 weeks, which is the first 3 months of pregnancy. And it is an outpatient procedure. An outpatient procedure, what do I mean? Clients come from home on the day of the procedure and they go back home the same day. Usually the procedure does not last more than, and this straightforward procedure does not last more than 15 minutes. And after which they are made to rest in hospital for about 30 minutes, and then they are discharged. Now, before coming for the procedure, they have been seen by a genetic counselor who will lay out the options on the table. And like I said, couples are at risk. Who are the couples at risk? There must be people who are likely to give birth to a child with a genotype hemoglobin SS or AC. That happens when somebody who has a genotype of AS marry another patient and that client who is AS. Or when a patient that is AS marries one that is SC, or somebody that is AS marries somebody that is AC. If it is an AS married to an AS, the chance is 25% in each pregnancy. People should not go away with the impression that it is 1 in 4. My first 3 pregnancies will be okay. It's only the 4th one. No, the probability of 25% or 1/4 is with each pregnancy. So the risk in each pregnancy if an AS marries an AS is 25%. That means 3 out of 4 chances the baby will be normal. It's only 1 in 4 that the baby has a chance of coming out as SS. Now, depending on the combination, the percentage could be as high as 50%. If an SS marry an SS, of course, the percentage is 100% in every situation. The chance of that baby coming out to be somebody with hemoglobin SS is 50%. So they are saved by a genetic counselor who tells the couple, preferably, what we'll do before we even subject them to this, a number of times, we need to confirm the genotype of the couple. Because I've seen instances, qualified consultants coming with real genotypes, which other laboratories outside will have classified as hemoglobin S. But in this place, we have the WHO standard laboratory that's able to identify such real genotypes. And when your genotype is determined and you don't fall within the criteria, then you don't go through the test. So we make sure patients coming for the test are qualified in terms of having the appropriate genotype. Number 2, we also make sure that the pregnancy must be of the appropriate duration. So when patients have been counseled, they now report for the procedure. The first thing we do is to do a preliminary ultrasound. What do we do with this ultrasound? This ultrasound helps us to confirm that truly this patient is pregnant, truly the duration of the pregnancy is of the appropriate length that we can carry out the procedure. We also know that truly the baby is still viable because in a number of instances, a number of women get pregnant, and in the first 2-3 months, the pregnancy gets doomed. Something you call blighted ovum or missed abortion, in which case, the pregnancy stops growing. The woman may not know until she carries out an ultrasound. So, in such an instance, if a woman is claims to be pregnant, she comes and we do an ultrasound, and the baby is no longer viable, or baby is no longer alive, she's disqualified. She's not qualified for that procedure. Now, if the woman comes and she's not up to 10 weeks pregnant, she's not allowed to go through the procedure too, because it's been shown that if this procedure is carried out too earlier than 10 weeks, the baby may stand the risk of having some abnormalities. So we don't carry out the procedure on pregnancies earlier than 10 weeks. All right. Then, like I also mentioned, we know that in Nigeria we have a high incidence of twins. And in these days and age when people go through in vitro fertilization to get pregnant, we have instances of 2 or 3plets. We have had triplets before. So we want to know whether is it a single baby we are having, or is it twins or a triplet? If it's a single baby, no problem. If it's twins, are the twins sharing the same placenta, in which case they're likely to be identical. What you do in that case is just a single biopsy. But if the twins or the triplets have different placenta, then you have to do 2 biopsies or 3 biopsies, because if they have different placenta, then their genotype are likely to be different. And having done this, you now choose the appropriate location to do the biopsy. Usually, this procedure is carried out by 2 individuals, the operator and then an assistant, who is equally an obstetrician and gynecologist. The procedure is carried out under direct ultrasound guidance. What you are doing, you are seeing it on the ultrasound as you are introducing your needle into the placenta, as you are taking your biopsy and everything, your sample, and this is done, or you are seeing it directly. You are visualizing what you are doing on the ultrasound machine. And straightforward procedure does not usually last more than 15-20 minutes. And having obtained the sample is now passed on to the lab scientist within the theater premises, who examines it under electronic microscope and make sure the appropriate sample has been done. What we are doing, the sample we are obtaining is from the placenta bed. And the basis of this is that the genetic material that makes up the baby and the placenta are from the same source. So when you obtain a sample of the placenta, you can analyze it to get to determine the genotype of the baby, and you can even use it to determine the sex. You can use it to determine the number of other to obtain some other genetic information concerning the baby. So that's the basis of this test.